Tens of thousands of people in England may still be unaware that they've been in close contact with someone who has COVID. A technical issue in transferring positive results from laboratories led to almost 16,000 missing cases. All those who tested positive were informed, but their close contacts were not, and thousands still haven't been. Many of the cases are in parts of northern England, already under local lockdown. The Health Secretary Matt Hancock told Parliament the problems still haven't been resolved and the incident should never have happened. The Shadow Health Secretary, Jonathan Ashworth, said the missing results were putting lives at risk. Here's our health editor, Hugh Pym.
Testing and tracing continues today, but there are yet more questions about whether the whole system in England is working properly, with thousands of cases not recorded, so contacts of those testing positive were not followed up. The Health Secretary had to come to the Commons to explain what went wrong.
This incident should never have happened, but the team have acted swiftly to minimise its impact, and now it is critical that we work together to put this right and to make sure that it never happens again.
Labour highlighted the failure to follow up contacts.
Thousands of people, blissfully unaware they've been exposed to COVID, potentially spreading this deadly virus at a time when hospital admissions are increasing and we're in the second wave. This isn't just a shambles, it's so much worse than that.
Here's what we were told at the time about the number of daily reported cases up until Friday, reaching around 7,000 by the end of the week. But now that the extra cases have been added in, here's what it looks like now, above 11,000. All the new data relates to England, with striking increases in some regions. In the northwest of England, for example, there were more than 8,000 extra cases reported, an increase of 93%. In the Yorkshire and Humber region, it was more than 4,000 extra cases, an increase of 113% on what we were originally told. Civic leaders affected by restrictions in the northwest say policy must be reconsidered.
Somebody should be checking this. This is a national government implementing the system and making decisions that are predicated on that evidence, and the evidence now we find has been faulty.
So how does the system work? Tests of hospital staff and patients are analysed at NHS and public health laboratories. These seem to be working well. Testing for the public in most care homes at drive-through centres or with kits is partly done by private companies. They then send the swabs to the big lighthouse labs to analyse tests. These were set up by the government and are run by private companies and universities. They then pass on results to Public Health England to be fed into the test and trace system for contacts to be followed up. This is where the IT problems have occurred. PHE says the issue has now been resolved, but wider challenges for people using the testing network remain. A surge in demand caused delays last month, and these are still happening. Jared was tested on Friday and still hasn't had a result. He and his flatmates, who are key workers, are having to isolate and stay off work.
Things should be in place by now, really. So it makes it difficult for people who are trying to do the right thing. So I can certainly understand the frustration and anxiety and stress that it produces other people who may not be as lucky to have people delivering food and support them through a challenging time, really.
The challenge for the government remains bolstering confidence in a testing system, which in recent weeks has fallen short of where it should be. Hugh Pym, BBC News.
Well, let's talk to our correspondent Danny Savage, who is in Leeds, and there's plenty of concern about this error there.
Yes, Sophie, there's anger and worry here in the north of England tonight over the consequences of all of this. Take Leeds, for example. There's an extra 2,177 new cases which have been added to the total after this recount following that error. And the north of England, if you like, is suffering a double whammy. It already has the highest infection rates, but it also had a significant proportion of those underreported cases were in this part of the country. So that means in the areas with the highest infections, there were potentially thousands of people getting on with their daily lives when they should have been at home isolating because they were the close contacts of those cases which didn't have test and trace acted upon them. And that's potentially help spread the virus further in areas which already have high numbers of cases. One other thought tonight as well. There's been sharp rises in cities such as Newcastle, Leeds and Sheffield. All of those are student cities. And just to give some detail on that, Manchester now has the highest total of infections in the UK at the moment at 495 cases per 100,000 people. But the head of public health in Manchester has looked specifically at the student population in the city and reckons that the infection rate there is astonishing, at 3,000 cases per 100,000 just in the student population alone. So I think the story going forward and the events of the next few days will have to watch closely at what those figures are like in student populations across the country in areas with a high number of infections. Sophie.
Danny Savage, Ian Lees, thank you. The Welsh Government is considering imposing quarantine restrictions on people who travel into Wales from coronavirus hotspots in the rest of the UK. The Welsh Health Minister is looking at the options after Boris Johnson said he did not want to stop people living in parts of England that are under local lockdown going on holiday in Wales. After a sharp spike over the weekend in new infections because of that computer glitch, the latest data shows the number of new cases has fallen to 12,594 that were recorded in the latest 24-hour period, though still significantly more than were being recorded last week. It means the average number of new cases reported per day last week is now 10,937. And as new cases have climbed, so have daily hospital admissions, with 408 people being admitted on average each day over the past week. This number doesn't include Scotland. 19 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. It means on average in the past week, 53 deaths were announced every day, and it takes the total number of deaths so far across the UK to 42,369. Well, let's talk to Hugh Pym, who's with me now. And as far as this computer error is concerned, do we have any idea how many people are going to be affected by this?
Well, Sophie, Labour think it could be as many as 50,000 people out there who don't know they might have come into contact with somebody who tested positive. Now, the government says that the contact tracing process started early on Saturday morning with extra resources. And actually, quite a lot of these new cases were towards the end of last week, so there may not have been too much of a delay. But the fact no one's quite sure about the numbers is potentially concerning. A lot of questions are going to be asked about this IT error. It seems that it was an old format which was used to put data into templates to then be uploaded into the central system, and the templates didn't have the capacity to take on some of the extra new cases. The fact that nobody seems to have realised this for a week, there were no IT alarm bells ringing, I think is another big question mark over the whole thing. So where are we with COVID-19 now? Well, Matt Hancock says his assessment and health officials hasn't changed, and the decisions made on restrictions wouldn't have been any different in the light of this. But I think the fact that we now know that cases were going up in the UK throughout last week and they're higher today without any extra added data suggests this will be watched pretty closely in the days ahead.
Hugh, thank you.